Hello guys, so in this video I will be talking about the typical intercostal rib, the thoracic vertebrae, right? Typical intercostal rib and the typical thoracic vertebrae, right? So this is a typical rib, right? This is a typical rib. Okay? What are its parts? Well, this is the posterior end, this is the posterior end, and this is the anterior end, right? And the middle part, this entire part is the shaft or the body of the rib, right? In the posterior end, you have three parts. Now, the posterior end has three parts. The head is divided by the crest, by a elevation in the middle, which is called the crest of the head, right? Divided into two facets, right? Superior and inferior facets. Then you have the tubercle. Tubercle has two parts, the medial articular part and the lateral non-articular part. And between the tubercle and the head is the neck, right? Between the tubercle and the head is the neck of the rib. Yes, sir? So if you are asked to hold it in anatomical position, right, you have to hold it in pen holding position, like this, right? Like this, pen holding position, right? The posterior end should be at a higher level than the anterior end. The ribs should be sloping forwards, right? Sloping downwards, forwards. Right. So this is about anatomical position and the parts. First, let's come to the easy ones, right? Anterior end. The anterior end. Before coming to the attachments, the rib has an outer surface, an inner surface, a superior border and an inferior border, right? The superior border is rounded, having two slips, two slips, an outer slip and inner slips, not lip. Okay, it has two lips, the outer lip and the inner lip. It is the superior border is rounded. The superior border is rounded, and the inferior border is thin and sharp, and has a costal groove, in the middle, right? This is the costal groove. There you will see a slight depression, right? That's the costal groove. Okay. Right. So now coming to the outer surface and near the anterior end. Okay, near the anterior end, the outer surface gives attachments to three muscles, but at different levels. The first eight ribs give attachment to the digitations of serratus anterior muscle, right? Digitations of serratus anterior muscle. The first 8 ribs. The last 8 ribs give attachment to the external oblique muscle, right? To the external oblique muscle. And the last 4 ribs give attachment to the latissimus dorsi muscle. Near the anterior end, the outer surface, right? Coming to the posterior end, right? The posterior end has the head, neck and a tubercle. এখানে most important হচ্ছে ligaments গুলো, ঠিক আছে? So the head has a superior facet and an inferior facet, separated by the crest of the head, right? The crest of the head gives attachment to the intra-articular ligament, which is the middle band of the tri-radiate ligament. First of all, if I take a vertebra, a pair of vertebra, right, and I articulate it here. Yes, see this. Yes, this is the costovertebral joint. Costovertebral joint, which is the plain synovial joint, and the ligament involved in a costovertebral joint is the tri-radiate ligament. The tri-radiate ligament has three bands, right? The superior band, middle band, and the inferior band. Superior band is present between this, it is present here, right, above the crest of the head, and the inferior band is present below the crest of the head, while the crest of the head gives attachment to the intra-articular ligament, which is the middle band, right, which is attached to the intervertebral disc, which is present between these two thoracic vertebra, right? So this is the costovertebral ligament. Now, in the formation of the costovertebral ligament, the superior facet of the head articulates with the inferior articular facet of the numerically higher vertebra, right, numerically higher vertebra, while the inferior facet on the head of the rib articulates with the superior articular facet of the corresponding vertebra. So if I say that this rib is the seventh rib, right, the seventh rib, then if this rib is the seventh rib, then the superior, the seventh rib, just take it as an example, right, can lekha ache jodio vertebra gulote, but don't have to see the names. So if I say this is the seventh rib, then the lower vertebra will be the seventh thoracic vertebra, right, while the higher one will be the sixth thoracic vertebra. So the inferior facet of the head of the rib articulates with the superior articular facet of the seventh vertebra, thoracic vertebra, and the superior facet of the head articulates with the inferior articular facet of the sixth thoracic vertebra. Understood? So next, the head is done. Next we come to the tubercle. The tubercle has a medial articular part and a lateral non-articular part. So the medial articular part articulates with a facet present on the transverse process. Forming a joint, a plain synovial joint, which is called the costo-transverse joint. The costo-transverse joint, like this, right? It articulates, the medial articular part articulates with the transverse process to form the costo-transverse joint. Now the costo-transverse joint has three ligaments: the superior ligament, the superior costo-transverse ligament, the inferior costo-transverse ligament, and the lateral costo-transverse ligament. So the medial part articulates. What does the lateral part do? Lateral part of the tubercle gives attachment to the lateral costo-transverse ligament. Which gets attached to the tip of the transverse process, ঠিক আছে? Then the inferior costotransverse ligament arises and attaches to the posterior surface of the neck of the rib, ঠিক আছে? The posterior surface of the neck of the rib and attaches on the anterior surface of the transverse process. This is the inferior costotransverse ligament. While the superior costotransverse ligament arises from the superior border of the neck of the rib and attaches to the higher to the inferior border of the transverse process of the numerically higher rib, ঠিক আছে? Numerically higher rib. So if I take this as a sixth rib, the superior costotransverse ligament attaches from the superior border of the neck of the rib to the inferior border of the transverse process of the sixth rib. If I take this as a seventh rib, right, then the superior costotransverse ligament will attach from the superior border of the neck of the rib to the inferior border of the transverse process of the sixth thoracic vertebra, if this is the seventh rib. Understood? Right. So this was all about the both costovertebral ligament and costotransverse ligament are plain synovial joints, ঠিক আছে? So this was all about the posterior end. Coming to the costal groove, right? Coming to the costal groove. The costal groove is present in the middle part of the inferior border, ঠিক আছে? The costal groove has two lips, ঠিক আছে? Two lips, an outer lip here and an inner lip here, ঠিক আছে? You will get it is more prominent in the middle 2/4, ঠিক আছে? And a floor, obviously. The costal groove lodges vein, artery, nerve. That is intercostal vein, intercostal artery, that means posterior intercostal vein, posterior intercostal artery and intercostal nerve, ঠিক আছে? Vein, in that order. Now the outer lip of the costal groove gives attachment to the external oblique muscle, right? External oblique muscle which attaches to the outer lip of the superior border of the lower rib, ঠিক আছে? outer lip of the superior border of the lower rib, ঠিক আছে? That is the external oblique muscle. The internal oblique muscle ওটা কোথায় attached আছে? In the floor of the subcostal groove, right, in the higher rib, obviously, and attaches to the inner lip of the outer border, ঠিক আছে? And attaches to the inner lip of the outer border of the lower rib, ঠিক আছে? So external oblique present on the outer lip of the outer border of the superior border, and internal oblique present in the inner lip, attached to the inner lip of the superior border, ঠিক আছে? While in the middle portion, in the middle 2/4, there is inner lip of the costal groove, the subcostal groove. It is more prominent there, and that inner lip gives attachment to the intercostal intimae muscle, ঠিক আছে? Intercostal intimae muscle, right? Understood? Typical rib are those ribs which are, I think, from T2 to T3 to T9, right? Yes, it's T3 to T9 are all typical ribs. T1 T2, T10. Sorry, T. No T, sorry. It's only third to eighth ribs are typical ribs, right? Third to ninth are typical ribs, right? While your first, second, 10th, 11th and 12th ribs are atypical ribs. Okay? Now there are true ribs and false ribs. True ribs are which ribs which are attached to the sternum directly. The anterior end attaches to the sternum, posterior end to the thoracic vertebra, which are attached directly to the sternum. Those are the true ribs, which are first to seventh ribs. They are also called sternocostal ribs. Yes, sternocostal, costosternal ribs. Costosternal bola jay. Costosternal ribs are the true ribs. False ribs are of two types. Ribs which are directly attached to T7. Directly attached to T7 are costochondral ribs, while the ribs which are not, whose anterior end is not articulating with anything, are the floating ribs, which are T11 and T12. So costosternal 1 to 7, then you have costochondral, which is 8, 9 and 10, which are attached to the 7th rib, and the floating ribs, which are floating ribs are also called false ribs, which are T11, which are 11th and 12th ribs, not T, 11th and 12th ribs. So this was all about rib. Coming to a typical thoracic vertebra. A typical thoracic vertebra has a body, has a massive body and a vertebral arch, which together form the vertebral foramen. This is the vertebral foramen. The body is heart shaped, right? The anterior-posterior and transverse diameters are almost the same. This is a body, right? Body, obviously, this superior surface, inferior surface both have intervertebral disc, and then attached are the other vertebrae, the other thoracic vertebrae. Now the outer surface, the anterior surface is curved, gives attachment to the anterior longitudinal ligament, while just behind the body, this portion gives attachment to the posterior longitudinal ligament. Anterior longitudinal ligament, posterior longitudinal ligament. Coming to the vertebral arch, these are the pedicle. These are the pedicle and these are the lamina. This portion, these are the lamina. This is the spine, thoracic spine, right? Coming to these one by one. So this is the pedicle. It is almost straight, right? There are two articular facets, superior articular facet and inferior articular facet, right? Like this. Superior articular facet and inferior articular facet at the junction of the pedicle and the body of the thoracic vertebra. Yes, sir? Now coming to these processes. There are some processes while pedicles, then they converge to form lamina. These two are lamina and form processes. Key processes: superior articular process. Here there is inferior articular process. Inferior articular process. Here, these are the superior articular process and inferior inferior articular process, okay, and superior articular process, right? Each of these bear a facet. Now there are transverse process, two transverse processes having a facet, each having a facet, ঠিক আছে? Obviously যা আগে বললাম আমি, the facet on the transverse process gives attachment to the medial part of the tubercle of rib, ঠিক আছে? Now coming to the processes, the মানে যেটা আমি বললাম আগে, the superior articular process and the inferior articular process, right? The superior articular process obviously articulates with the inferior articular process like this. See this. See, the inferior articular process, the inferior articular process articulates with the superior articular process like this. ঠিক আছে? You will see that the pedicle are present at a higher level, ঠিক আছে, attached to the body at a higher level, such that there is an inferior notch, ঠিক আছে, inferior vertebral notch, while the superior vertebral notch is shallow. So if I articulate the two vertebra, you see this hole, this space is called the intervertebral foramen. The intervertebral foramen, right, formed by the inferior vertebral notch and the superior vertebral notch. Acha. Now the superior articular processes are arranged in such a way they are diverging. You see, the two are diverging, while the inferior articular processes are converging. See this one. These two are converging. So the superior articular processes are diverging and the inferior articular processes are converging. If you articulate these two, you will observe that there is a rotatory movement, right? There is a rotatory movement. So the thoracic part of the vertebra actually allows rotatory movements, right? Due to the arrangement of the four articular processes, right? Coming to the spine. So the spine is formed by the two lamina converging and forming the spine, which like it is projecting downwards, right? It is projecting downwards and backwards a little bit, The spine gives attachment to the supraspinous and interspinous ligaments, right, and various muscles of the back, right? আর তেমন তো কিছু নেই বলার মতন about the superior and inferior articular facets. Superior and inferior articular facets, I've told you these articulate with the rib, that is the head of the rib, to form the costovertebral joint, right, which is a plain synovial joint, and the facet on the transverse process articulates with the tubercle, the middle part of the tubercle of the rib, to form the costotransverse joint, which is also a plain synovial joint. Acha. Another thing, the lamina on the inside, ঠিক আছে, gives attachment to the ligamenta flava. Okay, the lamina gives attachment to the ligamenta flava. This was one thing left. And obviously this vertebral foramen gives provides passage to the spinal cord and all the nerves, okay, spinal nerves, thoracic ekhane, so thoracic spinal nerves. So that's it for today. See you in the next video, and thank you for watching.